Hi everyone, I'm a doctor. And in this video, I'm going to talk about lumbar puncture. What is it? When do we do it? How do we do it? And what are the pros and cons of doing it? So let's start with what is a lumbar puncture. So lumbar puncture, also known as a spinal tap, is a procedure where we take a needle and we stick it into the lower back area, which is called the lumbar region, hence the name lumbar puncture. Now, why do we do a lumbar puncture? We do a lumbar puncture to be able to get a sample of the cerebrospinal fluid that is around your brain and your spinal cord. The reason why we want to get a sample of that fluid is because there are certain things in the body that can only be diagnosed by looking at that fluid. For example, certain infections like meningitis or encephalitis, which is inflammation of the covering of the brain and the spinal cord. Certain autoimmune problems, bleeding in the brain or the spinal cord, or even some types of cancer can be diagnosed by looking at a sample of the cerebrospinal fluid. Now, what are the pros and cons of doing a lumbar puncture? Well, the pro is that it's a relatively simple procedure that can help us make a diagnosis. The con is that it is not painful, but it is very uncomfortable, and there are some risks that come along with it, including headache, nausea, vomiting, bleeding at the site where the needle goes in. Rarely, we can have a hit to the spinal cord itself or an infection at the site where we do the lumbar puncture. But the benefit is more than the risk. If we get definite diagnosis through lumbar puncture, we can save the child's life and its overall well-being, and can prevent from unwanted, lifelong inabilities like cerebral palsy. I hope this video answered some questions. If it did, please make sure to subscribe so you stay updated with all our future videos. Take care, everybody.